Are here at Uhuru Park, where the strike is just about to kick off. We still have very few numbers here, but the nurses who are already here tell us that their colleagues are on their way. They have an array of issues that have not been mentioned over the last few weeks when we have been covering the strike that involves the nurses from the county government. These nurses here are under the national government, and they tell us that they feel ignored by the government since the health services were devolved after the execution of the constitution. And so now we are joined by the secretary, who is Maureen Zioka, who is going to tell us the issues that they want addressed by the government. You will remember that the government has already said that they don't have money to meet the demands by the nurses, and these nurses joining the strike makes the situation even more serious. Good morning, Maureen.
Good morning to you.
Tell us, what are the issues that you are presenting today, and what do you hope to achieve after this strike?
Okay, thank you. We, as the nurses of the national government, we've never been promoted since 2009, and we feel demotivated, demoralized, and frustrated. Having tried to reach our head office, that is Afia House, it has been hard on us. They never listened to us, and our cry is, we don't know which method it's being used by our colleagues in the county government that is not being used in the national government. We want to know exactly why we have never been promoted. We've stagnated in the same job group since 2009 up to date. And henceforth, we feel that we cannot even work again till we are promoted. Issue number 2 is return to work formula. This is a legal document that was agreed and signed by the 2 levels of the government and the National Union of Nurses. This document is very clear, and we want the national government to implement it, rather than them want to push this document under the carpet. So that's why we are out here, and we are demanding for our rights, because we are so demoralized, frustrated, and unless they do that, we are going back to work. And they do it even today, we will go back to work. Yeah, thank you.
And what are the issues addressed in this document?
The issues that are addressed in the document, it's about the allowances in the return to work formula. That in 2018 to 2018, they're supposed to have given us nursing service allowance of 3,000. 2019 to 2020, they're supposed to have increased 3,000 to 3,500 till from 2020 to 2021, still 3,500, amounting to nursing service allowance of 25,000. Then we're asking for 30,000. Then we're asking for uniform allowance that is supposed to increase yearly, 5,000 in up to 2021. That's supposed to amounting to 25,000 Kenyan money. So that's basically little money concerning to what we normally do, and the income that we normally bring forward to the country. And that's simple, and that is what we want. Thank you. Yeah.
Smriti, they are also talking about a challenge in the execution of their mandate. They're saying their numbers are very low. They're saying that the numbers that they issued last week are not correct, and that they are struggling in their execution of their mandate. And joining me is Stanley Nderito, who is going to shed some more light on that issue. Stanley, you are telling me about the numbers in the hospitals. Can you share with our audiences how working in the national government hospitals has been?
I think we have acute shortage, but from whatever we had from the document that was released by the SRC, it seems they are ghost workers, because in Mathare we have a working capacity of 168 nurses. Spinal injury, we have allowed 50, and other blood bank and ports have allowed 20 nurses. That makes allowed 250. So from the document that we saw, they are saying we are 1,200. So can we have an audit to ascertain this? Because there are so many ghost workers who are working. Because wherever I'm from National Spinal Injury, and I'm the ward in charge. So I'm talking from a point of knowledge. There is acute shortage, and our duty basically is to take care of the patient. So we are not able to attend to our patient to the maximum. We all the very necessary because of the acute shortage. Yeah, so my request is to Ms. Megish, if she is sure that we are 1,200, then there are so many ghost workers, and that is why we cannot even get our promotions and even this return to work formula as it is, because of those ghost workers, or maybe others in the ministry. There are executives who are having the dead people, and others, the other people who are paid that we don't know. But for now, we need a thorough audit to ascertain that number of 1,200, which is very critical because it's going to address the shortage that we are having already in the National Hospital. Yeah.
Thank you very much, Mr. Nderito. You have heard them, Smriti. Yes, we will be here for the better part of the morning. As you can see, they are just starting off their business today, and we will be here and we'll be following up this event today, and we will be giving you an update as soon as we get it.